Conclusion. Don't wait until it's too late. Your life is worth listening to. If you've read this far, I want to thank you, not just for your time, but for your willingness to face a truth that many men avoid. Prostate cancer isn't just a statistic. It's a silent intruder, and it's more common than you think. We've just gone through 12 early signs, some subtle, some surprising. And I want to remind you, none of these symptoms alone mean you have cancer, but all of them mean that your body is asking for attention, for care, for action. Because here's the thing most people never say out loud. It's not weakness to get checked. It's wisdom. It's strength. It's survival. I've treated thousands of men in their 60s, 70s, and beyond, men who caught their cancer early, treated it effectively, and went on to live full, active, joyful lives. And I've also stood beside men who came too late, who ignored the signs, who listened to fear instead of their own bodies. Let me say this clearly to you, my reader, my patient, my brother in age and experience. If you're urinating more often, if your back hurts without a cause, if you're more tired than usual, if something just feels off, don't wait. Get screened. Talk to your doctor. Ask questions. Prostate cancer, when caught early, is treatable, curable, beatable, and you deserve that chance. If this article helped you, if it opened your eyes or gave you language for something you've been quietly worried about, then please, don't. Keep it to yourself. Share it with a brother, a father, a friend. You might just save a life. And if you want to keep learning about men's health after 60, from intimacy and energy to cancer prevention and vitality, I invite you to subscribe to this channel. Here, we don't sugarcoat. We don't sell magic, pills. We give you truth, science, and compassion, the tools you need to take back your health, one informed choice at a time. Because aging isn't the end, it's the beginning of something wiser. And your body still has a lot to say, if you're willing to listen. Take care of yourself. And I'll see you in the next video. Introduction. The silent threat lurking within and why you must pay attention today. What if I told you that one of the most dangerous threats to your health right now may be growing inside your body, and you wouldn't even know it? You're not alone. Every week in my clinic, I meet men in their 60s, 70s, and even 80s who look perfectly healthy on the outside. They still play golf, laugh with their grandkids, and feel like they've got plenty of good years ahead. But beneath that confident surface, something silent has been taking root: prostate cancer. This disease doesn't knock loudly. It doesn't always come with dramatic symptoms or warnings. It whispers, it hides. And far too often it only makes itself known when it's already done significant damage. The reality is sobering. 1 in every 8 men will be diagnosed with prostate cancer in his lifetime. It's the most common cancer in American men after skin cancer. And for men over 60, the risk multiplies with each passing year. But here's the part that frustrates me most as a urologist. It doesn't have to be this way. This isn't a hopeless disease. In fact, when caught early, prostate cancer is one of the most treatable forms of cancer we know. The difference between survival and tragedy often comes down to awareness, simply knowing what to look for. That's why I created this content. That's why this article and this channel exist. To give you real science-backed information you can trust. To help you become your own best health advocate. To ensure you don't become another silent statistic. If you're over 60, or if you care about someone who is, I urge you to keep reading. Today, I'll walk you through the 12 early signs of prostate cancer that most men miss or ignore. Signs that can quietly signal trouble long before any test is ordered. And at the end, I'll also explain the major risk factors and lifestyle choices that may help prevent it. But before we dive in, I invite you to subscribe to this channel. Here, we speak directly and honestly about the health concerns that matter most to older men. We talk about real solutions, not myths or gimmicks. If you want to stay sharp, stay strong, and stay connected to your best years yet, you're in the right place. So let's begin, because your health doesn't wait. And neither should you. Blood in your urine, hematuria. When your body sends a silent red flag, imagine walking into the bathroom, looking down, and noticing a faint pink tinge in the toilet bowl. Your first instinct might be to shrug it off. Maybe. It's something I ate, or it's probably nothing. But as a urologist, let me be very clear. It is something. Blood in the urine, what we call hematuria, is one of the most overlooked and misunderstood early signs of prostate cancer. For men over 60, it's not something to ignore, even if it happens just once. There are two types of hematuria. Gross hematuria, when you can see blood in your urine with the naked eye. Microscopic hematuria, when blood is present but only detectable through lab testing. Either form can be significant, and while hematuria can be caused by less serious conditions like urinary tract infections, UTIs, kidney stones, or even strenuous exercise, it's also one of the first signs we see in patients with advanced prostate cancer. Why does this happen? The prostate gland sits directly beneath the bladder and surrounds the urethra. When a tumor develops in this area, it can press against blood vessels, disrupt surrounding tissues, or inflame the prostate, causing small amounts of blood to leak into the urinary tract. Sometimes, this bleeding is painless, which is why it's so often missed or dismissed. In my years of practice, I've had countless patients tell me they saw blood once or twice and ignored it for months, until other symptoms appeared and cancer had already progressed. That's why I emphasize this. Blood in the urine is not normal, ever. If you notice even a faint discoloration, pink, brown, or red, get it evaluated. A simple urinalysis and imaging can quickly rule out or confirm the cause. And if caught early, treatment for prostate cancer can be effective, manageable, and even life-saving. Please don't wait for the bleeding to return. Let your first sign be your first step toward action. Difficulty starting or maintaining. Urination. More than just getting older. Have you ever stood at the toilet and waited, only to finally produce a weak stream of urine? Or maybe you start just fine, but the flow suddenly stops midstream. Maybe you finish and still feel like your bladder isn't quite empty. You shake, wait, and still feel the urge again 10 minutes later. If any of these sound familiar, your body may be waving a flag, and it's not just aging. It's true that as men get older, urination changes. The bladder weakens, and the prostate naturally enlarges to some degree, a condition known as BPH, benign prostatic hyperplasia. But when urination becomes difficult or erratic, we must ask why. One possibility is prostate cancer. When cancer cells grow in the prostate, they can form tumors that obstruct the urethra, the thin tube running through the prostate that carries urine from the bladder. Think of it like stepping on a garden hose. The pressure builds, the flow weakens, and the whole system starts to strain. Over time, this obstruction leads to hesitancy, struggling to begin urinating, intermittency, starting and stopping midstream, dribbling, straining, or pushing, feeling of incomplete emptying. These symptoms might be mild at first, barely noticeable. Many men ignore them because they develop gradually, and because they've been told for years that this is just what happens when you get older. But prostate cancer doesn't wait for you to take it seriously, and what seems like a small annoyance today can evolve into complete urinary retention tomorrow, requiring emergency catheterization or surgery. Here's the good news. Catching this early allows us to act before damage sets in. Medications, imaging, and PSA blood tests can give us clear answers and options. So if you've noticed a change in your urination, however slight, don't chalk it up to age. Let's find out what's really going on. Inability to urinate. While standing, a strange shift with a serious cause. This is a symptom many men don't talk about, not even with their doctor. But I encourage you to pay close attention. Have you recently switched from urinating while standing to sitting down? Not for convenience, but because it's physically easier or the only way you can relieve yourself. That change might feel subtle or strange. Some men describe it as, "I just feel like I can't push it out unless I sit." Others say, "It's like something's blocking it when I stand." This phenomenon may seem insignificant, but it can be a sign of a growing mass inside the prostate that's obstructing the urethra more severely in certain positions. Here's what's happening. When you urinate standing up, gravity plays a role in the position of your bladder and prostate. If the prostate is enlarged due to cancer, it may press more forcefully against the urethra when upright, restricting the flow of urine. Sitting down can slightly shift the anatomy, relieving pressure and making urination easier. I've had several patients tell me they began urinating sitting down just to avoid embarrassment from dribbling or incomplete emptying. While this adaptation seems harmless and might even help with cleanup, it's actually a compensatory behavior for a deeper problem. Some may associate sitting to urinate with convenience, especially at night. But when it becomes the only way you can urinate effectively, that's a medical clue. It's also worth noting that men with this symptom often experience urgency without relief, a feeling of fullness after urinating, residual leakage or dribbling, longer time spent in the bathroom, while benign conditions like BPH can cause similar issues. The possibility of prostate cancer must be considered, especially if this shift has occurred recently or is worsening over time. If you've started to notice this in yourself, don't be embarrassed, and please don't stay silent. These subtle changes in your daily routine are exactly the kind of early clues that can guide us toward early diagnosis and treatment. Let's take the guesswork out of your health. Burning sensation while urinating or ejaculating. Pain is a yai. Message: don't ignore it. Let's be honest. Most men don't like talking about pain, especially when it involves urination or intimacy. It's uncomfortable, sometimes embarrassing, and often ignored. But as a physician, I can tell you this. Pain is one of your body's most reliable messengers. And when it shows up in these deeply personal functions, it deserves your attention. Burning sensation during urination or ejaculation is often described as a stinging, hot, or irritated feeling. It may occur only occasionally, or it might persist with every bathroom visit. Either way, for men over 60, this could be more than a passing infection. It could be an early indicator of prostate cancer. Here's why. The prostate gland surrounds part of the urethra, the tube that carries both urine and semen. When the prostate becomes inflamed or infiltrated by cancer cells, it can press on or irritate this channel. The tissue becomes sensitive, the flow becomes obstructed, and friction builds up, leading to discomfort or pain. Now, I won't lie. This symptom is commonly misdiagnosed. Many men assume it's a urinary tract infection, UTI, or prostatitis, and they're often given a round of antibiotics without further testing. Sometimes that helps. But if the burning persists, recurs, or happens alongside other warning signs like weak urine stream, pelvic pain, or fatigue, then we need to dig deeper. A real patient of mine, Jim, 67, came in after months of brushing, off pain during urination. His primary care doctor had treated him twice with antibiotics. But the burning came back. A simple PSA blood test and prostate exam revealed early-stage prostate cancer. Thankfully, we caught it before it spread, and he's doing great now. But imagine what could have happened if he stayed silent. So I'm telling you now, if you feel a burning sensation when you pee or during sex, don't self-diagnose and don't wait. Talk to your urologist. It may be nothing, or it may be the clue that helps you catch something serious in time. Frequent urination at night, nocturia. When sleep suffers, so does your health. Waking up once during the night to urinate? Normal. 2, 3, even 4 times? That's a red flag. Many men over 60 joke about their midnight bathroom marathons. But let me be clear. Frequent nighttime urination, called nocturia, is not just a normal part of aging. It can be a symptom of something deeper, including prostate cancer. Here's what's going on inside. As the prostate enlarges, whether from benign growth or cancer, it starts pressing on the bladder. This creates a sense of urgency, even when there's only a small amount of urine to pass. At night, when you're lying down, the kidneys also produce more urine. The result? You're up every few hours, walking in a daze to the bathroom. The problem isn't just the inconvenience. Poor sleep quality affects your immune system, memory, mood, and metabolism. Over time, sleep disruption can even increase your risk of other chronic illnesses like diabetes and heart disease. And yet most men don't say a word. They assume it's just age. Some even avoid drinking water during the day, which leads to dehydration and other problems. But let me ask you, has your nighttime urination increased in the past 6 months? Do you feel constantly tired, even after sleeping 7-8 hours? Have you begun planning your evenings or trips around bathroom availability? If so, this could be your prostate asking for help. And while nocturia can also result from diabetes, heart failure, or other urological issues, we must always rule out prostate cancer in men over 60 experiencing these symptoms. A simple exam, PSA test or ultrasound can reveal the truth and potentially save your life. Please don't normalize what disrupts your life. Your sleep is not disposable, and neither is your health. Unexplained weight loss. When pounds vanish without a reason, don't celebrate. Investigate. Losing weight without trying might sound like a dream come true, until you realize it can be a serious warning sign. As a doctor, I always ask older patients, have you lost any weight recently? And when they say, yeah, about 10 pounds, but I didn't do anything, my alarm bells go off. Weight loss that happens without a change in diet or exercise is not normal after age 60. In fact, it can be one of the first signs that something is wrong beneath the surface, including cancer. Prostate cancer, especially when it becomes aggressive or spreads, alters your metabolism. Your body's immune system revs up, trying to fight off abnormal cells. In the process, it burns through energy, muscle mass, and fat, whether you're eating more or not. Here are a few ways unexplained weight loss can present. Pants suddenly feel loose, even though you haven't changed your meals. Friends comment that your face looks thinner. You feel weak or lightheaded despite eating normally. This type of weight loss is often subtle at first. You might attribute it to stress, seasonal changes, or a better appetite. But if you've lost more than 5% of your body weight in 6 months without trying, that's enough to warrant investigation. One of my patients, Arthur, 72, lost 12 pounds in 3 months. He was thrilled, until fatigue, back pain, and frequent urination followed. Imaging revealed that his prostate cancer had spread to nearby lymph nodes. The early clue? That weight loss. The takeaway here is simple. Don't celebrate sudden weight loss after 60 without checking in on your health. It could be a gift from hard work, or it could be your body quietly asking for help, and you owe it to yourself to find out which. Bone pain. That doesn't go away. A signal from deep within, you know your body better than anyone else. You can tell the difference between a sore muscle from walking too far and a persistent nagging ache that just won't quit. If you've been experiencing bone pain, especially in the spine, hips, or ribs, that doesn't seem to heal, don't brush it off. It might be more than just getting older. When prostate cancer spreads, it has a habit of traveling to the bones first. In fact, bone metastasis is one of the most common complications in advanced prostate cancer. And while that sounds scary, the early signs are often subtle. Men describe it differently. A deep ache that's always there, especially at night. A sharp pain in my lower back, even though I didn't strain it. Pain in my hips that feels like something's gnawing inside. These pains usually don't respond to rest, heat, or over-the-counter medications, and they often worsen with time. Here's the biology. Prostate cancer cells, once they escape the gland, can settle in bone tissue. They disrupt normal bone metabolism, creating either weak, brittle spots or painful areas of excessive growth. This can lead to fractures, nerve compression, and debilitating pain if left unchecked. And yet, many men ignore these signs, especially if they're still mobile. One patient, Samuel, 68, told me, "I thought it was just arthritis. I've had back pain for years." But when we ordered scans, we discovered his prostate cancer had already reached the vertebrae. The difference between arthritis and cancer-related bone pain lies in persistence, progression, and location. If your pain is worsening instead of improving, located in the spine, hips, ribs, or upper legs, accompanied by fatigue or weight loss, then it's time to get checked. Don't let cancer gain ground in silence. Listen to what your bones are trying to tell you. Constant fatigue. When tired becomes unrelenting, it's normal to feel tired after a long day. It's not normal to feel exhausted from the moment you wake up, even if you've slept through the night. Fatigue is one of the most misunderstood symptoms in men over 60. People think it's just part of aging or the result of a bad night's sleep. But fatigue, true, deep, unshakable fatigue, is often the body's way of saying, "I'm fighting something inside." And in many cases, that something is cancer. Here's what cancer-related fatigue looks like. You feel drained even on days when you do nothing. A short walk around the block leaves you winded. Naps don't help. Caffeine doesn't help. You just feel depleted. Why does this happen with prostate cancer? Because as cancer cells multiply, your body's immune system goes into overdrive. It burns calories, redirects blood flow, and releases inflammatory chemicals, all of which sap your energy. Add to that the stress, anxiety, and sleep disruption that come with undiagnosed illness, and it's no wonder your tank feels empty. And here's an important truth. Fatigue is often one of the first symptoms to appear in metastatic prostate cancer, even before pain or urinary issues show up. That's why when a patient says to me, "Doc, I just feel off lately," not sick, just wiped out all the time, I listen carefully. If you're feeling a level of fatigue that interferes with daily life, if you've lost your usual spark, your stamina, your desire to move, please don't dismiss it. Let's explore the cause. A PSA blood test or basic scan could reveal something life-changing. Your body is incredibly intelligent. If it's slowing down, there's a reason. Let's find it before it finds you. 9. Blood in semen, hematospermia. A warning. During intimacy, few things are as alarming and confusing as noticing blood in your semen. It's not something men talk about often, even with their partners. But if this has happened to you recently, it deserves your full attention. Medically, this condition is called hematospermia, and while it can be caused by several benign issues, like infection, injury, or post-surgical healing, it can also be an early sign of prostate cancer. Here's what happens. The prostate and seminal vesicles produce much of the fluid that makes up semen. When the prostate becomes inflamed, damaged, or invaded by cancer cells, tiny blood vessels can rupture, releasing small amounts of blood into the ejaculate. This blood might appear bright red, fresh bleeding, brownish, or rust-colored, old blood. Mixed. Throughout the fluid or concentrated in streaks. For some men, it happens once. For others, it recurs over weeks or months. And while a single instance may not warrant panic, recurring hematospermia, especially in men over 60, should always be evaluated. I had a patient, Paul, 64, who noticed blood in his semen twice, but said nothing out of embarrassment. When it happened a third time, his wife convinced him to see me. A prostate exam revealed a firm nodule. Biopsy confirmed localized prostate cancer. Today, he's a survivor and a powerful advocate for speaking up. Let's be honest. Intimacy is one of the most vulnerable areas of a man's life, especially after 60. We associate it with masculinity, confidence, and vitality. But ignoring signs during intimacy doesn't protect that. It threatens it. If you see blood during ejaculation, don't be afraid to ask for help. It's not shameful, it's smart. And it might just be the sign that leads you to an early, successful diagnosis. 10. Weakness, numbness, or tingling in legs or feet. When the spine sends a silent SOS, you might not expect prostate cancer to affect your legs, but it can. And when it does, the consequences are often serious. If you've been noticing numbness, tingling, or weakness in your legs or feet, especially if it's new, worsening, or accompanied by back pain, don't assume it's just sciatica or a pinched nerve. It could be a neurological consequence of prostate cancer spreading to your spine. Here's how it works. As prostate cancer progresses, it can metastasize, or spread, to the bones of the spine. When this happens, tumors can press against the spinal cord or spinal nerves, interfering with the flow of nerve signals to the lower half of your body. The result? Strange sensations, muscle weakness, even loss of balance or bladder control. In fact, some men experience difficulty walking or standing for long periods, a pins and needles sensation in the legs or feet, loss of strength in one or both legs, sudden urinary or bowel incontinence. In the medical world, we call this spinal cord compression, and it's an emergency. If left untreated, it can lead to permanent paralysis or loss of function. I remember a patient, Edward, 71, who came in for leg weakness that had progressed over 2 weeks. He thought it was due to aging or arthritis. An MRI revealed metastatic prostate cancer compressing his lumbar spine. We acted quickly, and today he walks with confidence again. But just a few more days, and the damage could have been irreversible. If you notice these symptoms, seek immediate evaluation. It might not be cancer, but if it is, time is of the essence. The nerves don't lie. When they're under pressure, your body speaks. Please listen. Blah. Persistent pain in the pelvic area, lower back or upper thighs. The body's deep warning. Belle, we've all experienced aches and pains, especially after a long walk or sleeping in a bad position. But what if the pain doesn't go away? What if it lingers for weeks, comes in waves, and sits deep in your bones or muscles? Pain in the pelvic region, lower back, or upper thighs is a hallmark symptom of prostate cancer that has begun to grow beyond the gland. Let's look at the anatomy. The prostate sits low in the pelvis, nestled between the bladder and rectum. As cancer expands, it can irritate surrounding nerves, invade nearby tissues, or trigger inflammation that radiates pain outward. What's especially tricky is that this pain isn't always sharp. It may feel like a constant pressure deep in your groin, a dull ache in your lower back, radiating soreness down your thighs, discomfort when sitting for long periods. One patient of mine described it as a heaviness, like something's pressing from the inside. Another said, "It's not unbearable, but it never goes away." This kind of pain should never be ignored, especially if it worsens with time. It's not linked to injury or movement. It coexists with urinary changes, fatigue, or weight loss. Pelvic pain is a warning bell. Not always loud, but always important. In many cases, an MRI or CT scan can help us determine the cause. And if it's prostate cancer, early treatment can prevent further spread and relieve the pressure causing the pain. Remember, your body has remarkable ways of telling you when something isn't right. And when pain lingers in the core of your body, it's time to get answers. Q. Erectile dysfunction, ED. Not just about aging, it could be a hidden clue. Let's talk about a topic many men avoid: erectile dysfunction, ED. It's deeply personal, often emotionally painful, and sometimes assumed to be just part of getting older. But here's what many men don't realize. ED can be one of the earliest symptoms of prostate cancer. Yes, aging affects erections. So do conditions like diabetes, high blood pressure, and stress. But when ED appears suddenly or worsens without, Explanation. We must look deeper, especially in men over 60. Why does this happen? The prostate plays a key role in sexual function. It helps produce seminal fluid and is located near nerves and blood vessels critical to erections. When cancer invades the area, or causes inflammation, it can damage these delicate structures, leading to inability to achieve or maintain an erection, loss of morning erections, reduced sensitivity or orgasm quality. And that's not all. Treatments. For prostate cancer, such as surgery, radiation, or hormone therapy, can also affect sexual function. That's why identifying the problem early is crucial. It gives you more treatment options and better chances of preserving intimacy. One of my patients, Harold, 66, came to me for ED that started out of nowhere. No major stress, no diabetes, no vascular problems. We ran a PSA test and found elevated levels. A biopsy confirmed early-stage prostate cancer. Because we caught it early, Harold received treatment that preserved both his health and his sex life. If you're experiencing ED, don't suffer in silence, don't self-medicate, and please don't just accept it as normal for your age. You deserve answers. You deserve care. You deserve hope. And it all starts with a conversation. Conclusion. Don't wait until it's too late. Your life is worth listening to. If you've read this far, I want to thank you, not just for your time, but for your willingness to face a truth that many men avoid. Prostate cancer isn't just a statistic. It's a silent intruder, and it's more common than you think. We've just gone through 12 early signs, some subtle, some surprising. And I want to remind you, none of these symptoms alone mean you have cancer, but all of them mean that your body is asking for attention, for care, for action. Because here's the thing most people never say out loud, it's not weakness to get checked. It's wisdom, it's strength, it's survival. I've treated thousands of men in their 60s, 70s, and beyond. Men who caught their cancer early, treated it effectively, and went on to live full, active, joyful lives. And I've also stood beside men who came too late, who ignored the signs, who listened to fear instead of their own bodies. Let me say this clearly to you, my reader, my patient, my brother in age and experience. If you're urinating more often, if your back hurts without a cause, if you're more tired than usual, if something just feels off, don't wait. Get screened. Talk to your doctor. Ask questions. Prostate cancer, when caught early, is treatable, curable, beatable, and you deserve that chance. If this article helped you, if it opened your eyes, or gave you language for something you've been quietly worried about, then please, don't keep it to yourself. Share it with a brother, a father, a friend. You might just save a life. And if you want to keep learning about men's health after 60, from intimacy and energy to cancer prevention and vitality, I invite you to subscribe to this channel. Here, we don't sugarcoat. We don't sell magic pills. We give you truth, science, and compassion. The tools you need to take back your health, one informed choice at a time. Because aging isn't the end. It's the beginning of something wiser. And your body still has a lot to say if you're willing to listen. Take care of yourself, and I'll see you in the next video.